Welcome to Chiropad TV. This is Dr. Paul Bindell, President of Life Systems Software. It is with great pleasure that we provide you with this segment of our video training series for the ChiroSuite programs. This presentation will focus on the physical examination. Within Chiropad, open the patient's account and then come to the Exams button on the lower left side and select Physical. When the screen opens, you will see that there are several different tabs so that you can enter information. Keep in mind that we give you the option to fill in information. However, you only need to fill in that which you actually use. So if you note which hand is dominant, that is fine. If you choose not to make an entry, that is also good. Entering the patient's height, you can either actually type it in, or you could use the up and down arrows to get it entered. The same thing with weight, the same thing with body temperature, the same thing with the pulse rate. You could either type it in or use the arrows. And the same with the respiratory rate. As far as the blood pressure is concerned, you have options for left and right, as well as comparison blood pressures from before and after your treatment. If you check blood pressure at all, then obviously make the entry. If you do not check blood pressure, you can just skip this area. If you're examining the patient's blood pressure, testing it in the left arm, then be sure that you enter it correctly. And note whether this blood pressure was taken with the patient sitting, standing, or supine. If you check blood pressure on both arms at the same time, then you make the appropriate entries. If you check blood pressure after the adjustment as well as prior to, then put a check in the box that says comparison blood pressure and fill in the appropriate areas. The next tab on this screen is for postural, mental, and physical situations. We click on that and then select walking gait. Note what it is, and if you need a descriptive term that is not on this list, put a check in the box next to the star. That opens up an area where you can click into it and then just type in the rest. Click apply, and that will now be part of the patient's notes. If the patient has a limp, note which leg is favored by the limp. Also, what is the condition of the patient's body movement? Is it guarded or restricted in some manner? And if you want to add to this list, you can simply click on the ellipsis, the little square with the 3 dots on the right, and then click next to the star and add in whatever additional item you would choose. If there are things on this list that you absolutely never use, you can click on that item and then click on delete, and it will be removed. Once you've done that, you can close that screen, and it will now be available in the drop-down list. What is the patient's physical build? Again, you have a group of things to choose from, and if the item you need is not on this list, click on the ellipsis and enter it, and then close the screen so that it is on your drop-down box. And what is the patient's level of physical fitness? Again, if it's not on the list that appears, click on the ellipsis, add in whatever you need, and then close this and make the selection from the drop-down box. Some doctors like to keep track of the patient's race, feeling that that has an impact on their health. If you do, then check the appropriate box, and if you need to, you can click next to the end and add in whatever is necessary. The other area is for an assortment of miscellaneous observations that you would have of the patient. So you can go down this list, and if what you need is not here, just click next to the starburst and type in whatever is necessary. Note that once you put something on this list, even though it will not show up in other patients' notes, the list will be maintained so that it will be an optional choice in any other patient that may need it. Always, when you're finished making an entry, click Apply so that it will be saved. What is the patient's posture? Are they standing erect? Are they in an antalgic posture? Are they guarded? Is some part of the body distorted? You can make those entries, and once again, if it's not on the list, click next to the starburst and type it in. What is the patient's mental state? Keep in mind that this is just a basic observation. This is not based upon any thorough mental evaluation. If what you want to say is not on the list, put a check in the box next to the asterisk and type it in. You will note that with all the boxes that appeared here and all the selections, that if you're going to add something in, you only add a word or a brief phrase, because these items will become part of another sentence. The next tab here is for those that do head examinations. You can note whether or not there was any abnormality of the ears, nose, or throat, simply by putting a check in the box. The idea here is that if you do put a check in any of these boxes, that you would then click into the space below and describe what that abnormality actually is. In addition, if you find abnormalities of the lymph nodes, you would need to note which lymph nodes it is, and is it a solitary finding? Is it normal? Were the lymph nodes enlarged or enlarged and tender? You can add to this list simply by clicking next to the starburst. The next area is for the heart examination. If the heart is abnormal, then you would put a check in this box, and then you would note whether it was the heart rate, the heart rhythm, or if murmurs were present. And if murmurs are present, you would also note if they are systolic murmurs, diastolic, or presystolic. Also, if the heart is abnormal, you have the ability to indicate abnormal heart sounds. So you would be able to put a check next to the box of those heart sounds, and if it's not on this list, click next to the starburst and add it in. As far as auscultation is concerned, you have a drop-down box that gives you some choices. If you need to add to this list, you can click on the ellipsis and add to the list very easily. If there are things on this list that you never use, you also have the ability to click on it and delete it. In addition, if you're listening to the carotid artery, you will be able to have choices, and there's another ellipsis to add to the list if you need to. And if you listen to the abdominal aorta, then you will be able to make the selection from here or add to the list whenever it is appropriate. The final tab in the physical examination area is for the lungs. When you click on that, if the lungs are abnormal, you would put a check in the box and then note which section of the lungs is abnormal and what type of sound is produced that you are determining is abnormal. As far as your chest circumference is concerned, this can also be an indication of lung capacity. So it would be a pre-inhalation measurement of the chest would be entered as the normal, and then the inhaled chest circumference would be noted after the patient takes and holds a deep breath. Once you have completed the physical exam, you must click on the save icon. At a future point in time, if you want to refer back to this specific examination, you will be able to click on the drop-down arrow and select the date of the exam. When you select that date, it will show you what your findings actually were.
Thank you for watching this training video. Should you have additional questions that were not answered here, please contact support@chiroped.com or call us at 973-625-3716. We will do everything we can to make sure that you get the maximum benefit from using the ChiroSuite programs.